Good afternoon, everyone. Welcome back to my YouTube channel. Thank you for tuning in. Thank you to my returning subscriber. So today I am going to be demonstrating how to do perineal care. Perineal care is one of Prometric scale, state board exam, and you need to be very competent in performing this skill. So as always, I knock, come in, introduce myself. Hello, my name is Miss Henderson. Good afternoon, and I'm here to perform, I'm here to clean you up. Please do not set perineal care because the patient, it's a block to effective communication. They do not understand medical terminology. You can speak to a nurse or maybe another CNA that you're going to go do peri-care, but the patient doesn't understand that. You have to speak in layman terms to your patient. Okay, she said, okay, I'm going to be right back. I'm going to wash my hands, gather my supplies. I come back. The supply for this skill is, I'm going to need basically 2 chucks. I'm going to need several washcloths. I'm going to need soap. I'm going to need several pairs of gloves. I have to grab my gloves. I'm going to need at least 2-3 pairs of gloves for this position, for this skill. So I have all my equipment here. I come back to my patient, and when I come back, I am going to immediately draw the curtain to maintain the privacy and dignity of the patient. I am going to raise my bed to working level. I am going to take this side rail down because I'm going to be working on this side, so I need to drop that. My bed is to working level. My bed is locked. My privacy curtain is drawn. And what I need to do now, I'm going to get some water. I'm going to check the temperature of the water. I'm going to have Mrs. Jones. I checked her identification. She said her name is Mrs. Jones, and she said her date of birth, October 4th, 1949. Check the temperature. Is it comfortable, Mrs. Jones? She said yes. Okay. So at this time, I am going to be applying a gloves on. So guys, you could either place a chalk under her back now, or either way, when you turn her to do the rectal area, you could place a chalk at that time too. So it doesn't matter, but I think it's more logical if you do the peri first, and then when you turn her on the side, then you can place a chalk. Or if there is a chalk under her, that's fine. You don't have to place a chalk. If there's a chalk under her, just go ahead and clean the rectal area and then dispose of that chalk and use a new chalk. So either way is correct. So Mrs. Jones, I am just going to expose a little bit of the area so I can clean you. Is that okay with you? She said yes. So I just expose. I don't want to expose her too much. So I'm going to place soap on each one of these flaps that I've created. And what I'm going to do is that, so guys, I've exposed the area that I need to clean. And if my patient didn't have a chalk, at this time I would have to turn my patient and place a chalk. But she has a chalk under her, so I don't need to place a chalk. There's a chalk there. So I have my different flaps. What I'm going to do, I'm going to spread the labia, and I'm going to clean from front to back, starting with the side closer to me. 1, Tuck that in. 2. Are you feeling any pain, any discomfort? She said no. Be gentle because you know it's a very sensitive area. 3. This is my soapy water. Now I'm going to use rinsing water, and I'll just go through back the steps again. Spread the labia. 1. Tuck that in. 2. Tuck that in. And 1 to the center. How are you doing, Mrs. Jones? Good? She said yes. I'll take a drying towel to pat dry. She's good. Okay. Cover your patient back. At this time, I am going to proceed to take my gloves off, wash my hands, and get a new set of water. I got my new set of water. Mrs. Jones, is the water comfortable for you? She said yes. Mrs. Jones, what I'm going to do, I'm going to be turning you on that side. Is that okay so I can clean your back? Is that fine? She said yes. I am going to lower the head of the patient. So you can't have the head high when you're going to turn your patient on that side. The head has to be low. All right, that should be good. Mrs. Jones, can you help me to hold on the side rail when I'm turning you, if that's fine? I'm going to move you now in 3 segments. 1, 2, 3. You can either lift her legs up, cross her arm. On a count of 3, I'm going to turn you on the side. 1, 2, 3. Just hold on to the side rail to support yourself. Is that okay? All right, so now she has the barrier that I was talking about. I'm going to proceed to clean her. Okay, so clean the side that is closer to you. I'm using the 4 corners, so I have 4 wipes. 1, 2, and 3. You want to go upwards because the reason for that, if you go upwards, it's good. If you go downwards, that means all microorganisms are being pushed into the rectal and the vaginal area, which can definitely contribute to causing a urinary tract infection. That's the rationale why you go upwards on the butt. Okay, this is my soapy water. I have my rinsing water. I'm using the 4 corners. 1 swipe up, tuck that in. 1 swipe up, and 1 swipe into the rectal area. Mrs. Jones, I am going to dry your back. Is that okay with you? She said yes. So I dried, pat dry, pat dry. Mrs. Jones, at this time, I'm going to be changing your bed protector or chuck. I'll replace it with a new one because there's some water on it. Is that okay with you? She said yes. Fold it in. Mrs. Jones, on a count of 3, I'm going to go ahead and turn you to this side. Mrs. Jones, I am going to be placing this side rail up. At this time, I will proceed to that side. I'm going to take this side rail down. I'll move my patient closer to me. 1, 2, 3. I'm going to cross her legs. I'll cross her arms. Mrs. Jones, on the count of 3, I'm going to turn you on the left side. Be sure to hold on to the side rail for extra support. 1, 2, 3. Very good. I'll remove my dirty chalk. Throw that into the hamper and have my clean chalk under. Place back your patient in a supine position and give her the call bell. Mrs. Jones, I'm going to be right back. I'm going to go dispose of my material and come back and make you comfortable. Since I'm walking away, I want to really see. Now, I am going to be disposing of the water, dispose of it, disinfect the basin 3 times with clean water and soap. Take a dry piece of paper towel, dry the basin, and place it back in its designated area. I am going to proceed to put everything into the dirty hamper. I am going to take my gloves off, throw this into the trash, come back to my patient, cover her. Make sure you cover her nice and neat. So Mrs. Jones, you're nice and clean. How did it go? She said it went well. So feel nice and clean. At this time, I am going to lower the patient's bed. Mrs. Jones, would you like your head of the bed to be elevated? She said, yes, I'll raise it to 30 or 45 degree angle. Would you like to look at TV? She said, yes. Here is your remote. Here is your call bell. If you need me for anything, please buzz me. At this time, I'm going to remove my privacy curtain. I'll take a moment at this time. I'll review my scale. Is my bed in lowest position? Is the call bell within close reach? Is the curtain undrawn? And I'll take a moment to just review it. And if it's correct, then I can tell my evaluator my scale is now completed. Guys, this is it for this video. Thank you so much for tuning in, and thank you so much for supporting this channel. And if you like these types of content, please give me a thumbs up, like and share, smash that subscribe button, and drop your comments below. I'll catch you in the other video. Thanks for watching.